les camps de travail se sont propagés dans d'autres régions du pays après le retour à la maison des travailleurs. Toute personne qui revient au Nouveau-Brunswick après avoir travaillé dans une autre province doit s'auto-isoler pendant 2 semaines. Et on sait que l'information que les gens reçoivent en hors du province peut être différente que le message que vous recevez ici dans notre province. Mais la loi ici au Nouveau-Brunswick, c'est celui qu'on suit. Family support is vital for this. I appeal to partners, parents, and friends to support people coming from outside the province so they can avoid contact with other New Brunswickers. Help them by getting food, help them by getting supplies, making sure they have a comfortable place where they can be isolated from others safely. And if you can't help them isolate safely, then maybe they should be isolating elsewhere where they can have a room of their own, a bathroom of their own, and not have to share any utensils or personal items with anybody in the household, especially if you have a vulnerable person in your household. And especially if you have somebody who works in a closed facility or if you have a child in daycare. It's very, very important to limit these types of contacts. These are challenging times. And as much as we have come through, there is more to go through yet. And I'm very grateful and proud of what we have achieved, and I acknowledge the difficulties. So take care of yourselves, take care of each other. New Brunswickers are counting on you to continue to make good decisions that protect all of us. Il est naturel d'éprouver du stress, de l'anxiété, de la peine et des inquiétudes en ces temps difficiles. Personne réagit de la même façon et nos sentiments changeront avec le temps. Remarquez et acceptez comment vous vous sentez. Si vous prenez soin de votre santé émotionnelle, cela vous aide à penser clairement de façon à pouvoir mieux vous protéger et mieux protéger votre famille. Alors, je suis très fière de ce que vous avez accompli déjà collectivement et j'espère qu'on pourrait continuer ensemble avec les bonnes décisions collectivement ici au Nouveau-Brunswick pour tous les citoyens. Merci.
Bonjour, good afternoon. Since this pandemic began, essential workers across the province have stepped up for New Brunswick. In recognition of this, our province has sent a written request to the Federal Finance Minister outlining a program to provide a monthly top-up of $500 for 16 weeks for frontline workers in a number of sectors. This includes early learning and child care facilities, home support, special care homes, community residence and group homes, homeless shelters and food banks, domestic violence outreach, and transition homes. Workers must earn $18 per hour or less to be eligible. The top-up will be paid by employers at the end of each 4-week period, except for early learning and child care facilities, which will split the first and last payments to align with existing payment schedules. This will begin on May 19th for early learning and child care facilities and continue for the 16 weeks to recognize staff for coming back to work and supporting our economic restart. All other sectors will be paid retroactively from March 19th and continue through July 9th to recognize staff for helping to get New Brunswick where we are today. Employers will be reimbursed by the Department of Education and Early Childhood Development or Social Development. Partout dans notre province, la majorité des gens continuent à respecter les directives de la santé publique et à faire ce qui est nécessaire pour garder notre population en santé et en sécurité. Merci pour tous les efforts que tu fais. Vos efforts expliquent une partie pourquoi nous n'avons pas ce cas actif de COVID-19 présentement au Nouveau-Brunswick. During these extraordinary times, the health and safety of New Brunswickers continues to be our top priority. We have worked hard to flatten the curve and contain the spread of COVID-19. As we continue to move through the phases of our recovery plan, it is important to remember COVID-19 still poses a risk to our communities. That is why New Brunswick has chosen to keep its borders controlled at this time. Hundreds of people are being granted access every day at the crossings into Restigouche County. Information gathered over the last 7 days indicates that each day an average of 509 vehicles attempt to cross into Campbellton. Of those vehicles, an average of 18 vehicles a day were denied entry. All unnecessary travel into New Brunswick is prohibited, and peace officers are authorized to turn visitors away when they attempt to enter. It is recognized that some travel is necessary. This includes residents of other provinces who must enter New Brunswick to work or receive medical treatment, and commercial vehicle drivers delivering goods. Quand des résidents d'autres provinces veulent entrer au Nouveau-Brunswick, on leur demande d'expliquer la raison de leur déplacement. Si on juge qu'un déplacement est de nature essentielle, ces résidents seront autorisés à entrer au Nouveau-Brunswick uniquement pour les raisons qu'ils ont mentionnées. Les résidents devront aussi retourner dans leur province d'origine après avoir accompli cette tâche essentielle. Quebec, Nova Scotia, and Maine all have active cases of COVID-19. Now is not the time for New Brunswick to take unnecessary risks, undoing all of the hard work it took to get us to this point. By pushing against restrictions, you are endangering not only yourself, but your family, your friends, and your fellow New Brunswickers. You are also putting our essential workers at risk, including those who are on the front lines of this pandemic. If you have symptoms of COVID-19, you must get tested. If you are ill, you must stay home. We all have an important role to play in keeping our frontline workers safe and one another safe for health and safety reasons. Cela n'a pas changé, et cela ne va pas changer, alors que vous travaillons pour rouvrir notre province. Il est même plus important que jamais de travailler ensemble pour minimiser les risques. Just over 50% of New Brunswickers' daycare centers opened yesterday. That number is expected to reach 80% by June 1st. The reopening of daycare centers is a key element in enabling people to return to work. New Brunswickers must be able to return to work if we are going to reopen our province. To continue to take the necessary steps and move into the next phase, we must continue to obey the directives of public health. We can't do this alone. Nous sommes en mesure de pouvoir envisager les prochaines étapes à suivre parce que vous avons travaillé en équipe. C'est un résultat que nous avons atteint ensemble. Et c'est un résultat dont nous pouvons être fiers. Nous devons être fiers de faire notre part pour soutenir notre province. Now you can show your pride and help support vulnerable New Brunswickers. I'm pleased to announce that the United Way is going to be selling Stepping Up for My New Brunswick, Femme à part pour mon Nouveau-Brunswick t-shirts, with the proceeds going to support mental health in our province. Communiquez avec l'organisme Centraide de votre région pour commander un t-shirt et montrer votre soutien envers votre province. C'est le tout nouveau moyen choisi par les gens de Nouveau-Brunswick pour montrer leur nature résilient et compatissant. From signs thanking hospital staff to encouraging messages in windows and on sidewalks, as well as drive-by birthday parades, people are staying connected and grateful. This hasn't been easy, and the pandemic is not over, but your kindness, creativity, and optimism remain strong. We will and we are getting through this together. Thank you. Merci.
Merci, Monsieur le Premier ministre et Dr. Russell. Thank you, Dr. Russell and Premier Higgs. Nous allons maintenant procéder aux questions des journalistes. Vous avez toujours le droit de poser vos questions dans la langue de votre choix. We'll now proceed with questions from the media. You have the right to pose the question in the language of your choice. Vicky Hogarth, Charlotte County TV.
Thank you, Bruce. My question is for the Premier. Premier Higgs, businesses that take reservations months in advance, such as resorts and whale watching expeditions, are wondering if they should cancel their bookings for out-of-province guests and customers for the months of July, August, and September. What do you recommend they do at this time?
Hi, Vicki. So Oh, before I answer your question, though, I know people were asking about my hair, and I'm just telling you, don't try this at home, folks, but I used a YouTube video, and it was the ponytail method, so I'm just clarifying that I did it myself. So, coming back to your question, Vicki, right now, our province has really tried to maintain really great border measures. The criteria for being able to open up inside the province for New Brunswickers to have businesses open up and be able to have more outdoor activities, et cetera, and connections is reliant and based on being able to keep our border measures in place and tight controls. So while we are doing our opening up phases and moving forward, we at this point in time will be maintaining the measures that are in place currently. So with respect to anybody who has bookings from out of province, it is hard to predict at this time, but based on the information we have today, we're not planning to make any changes at this time. The other thing is that at any time as we move through the different phases, we do have criteria to ramp back. So even if you were to make reservations around any of these things, there is a bit of uncertainty in the next 18 months, really, to 2 years until there's a vaccine, because at any time we could see a resurgence, we could see a second wave of an increased number of cases. So it's always important to keep that in the back of everyone's mind when they're making plans.
Thank you, Dr. Russell. Ms. Hogarth, do you have a follow-up today?
I do. Thank you, Bruce. Thank you, Dr. Russell. My follow-up is for Premier Higgs. Premier Higgs, is the province aware of any rural airports, such as on Grand Manan Island, being used by out-of-province chartered flights? And if so, how are they being monitored?
So I'm not aware of them being used for out-of-province flights. I know flights have to be recorded, and so our public safety officers would be in a position to monitor that. I know they're certainly monitoring flights within provinces, or let's say regular scheduled commercial flights, be to any province. So I will ask that question after this in relation to, are we monitoring particularly Grand Manan, to your point, but I have not had any reports of outside flights into our province.
Thank you, Premier. Thank you, Ms. Hogarth. Elizabeth Fraser, CBC.
Hi there. My question is for the Premier. Over the long weekend and also today, some reopened businesses and parks were filled with people not respecting physical distancing or mask guidelines, particularly in the Fredericton area. What are you going to do about this?
Well, the emergency measure order stays in place. We are monitoring these facilities. We know that was a risk. I know in our discussions with Dr. Russell and in relation to, well, we have to move the economy and get forward and move on. I guess to think that we're going to be able to, enforce this in every area, in every campground throughout our province is an unworkable prospect. However, what I would like to say and encourage is this isn't about, I didn't social distance and I didn't get caught. This is about us being able to maintain 0 deaths, 0 cases, and be able to open up our province like no other one in the country at this stage. And if we will only be able to do that if people recognize that the newfound freedom we have is one that we have earned together collectively. It's one we can lose individually. Because somebody who feels that they're immune, it's not their problem, I don't need to pay attention to this, could be the one that reintroduces COVID back into our province, and we end up shutting things down again because we lose control of it. So I'm asking every citizen, as we enjoy our great outdoors this summer, we got lots of room to space out.
Thank you, Premier. Ms. Fraser, do you have a follow-up today?
Yes, thank you. I have another question for the Premier. People from Quebec are calling for a bubble to be created between Campbellton and nearby communities in Quebec like Pointe-à-la-Croix and Listigouche First Nation. Have you considered a bubble with this specific part of Quebec?
We haven't had a discussion directly in that regard. Certainly, I haven't with public health, and it isn't anything that we've put a lot of time in at this stage. I know there was a protest on the weekend. I think we have to be careful because if we start introducing sections of a one province to another without any ability to control the movement within one province or another that you choose a section of, it then becomes a greater risk. I think what we're seeing now, our ability to go into phase 3 in the coming days. It allows us to open up further our actions while continuing to monitor essential flow across the borders. I don't think it's too much to continue to ask that we maintain our border activity, and to Dr. Russell's point, it is our main line of defense. So we need to be sure that we're doing it properly. We're recognizing the needs, we're recognizing new, requirements or potential relaxations in the phase 3, which I hope will help, but at this point, each province does have its own border with essential service movements only.
Thank you, Premier. Thank you, Ms. Fraser. Michel
Thank
Corriveau,
you so much.
Radio-Canada.
Oui, bonjour. Ma question est pour le Premier ministre, M. Higgs. Alors, M. Higgs, au sujet du programme dont vous avez parlé tout à l'heure en introduction pour les travailleurs essentiels à faible revenu, donc un total de 2 000 $ pour les gens qui sont admissibles, est-ce que c'est... qui va être admissible exactement? Est-ce que c'est en fonction du nombre d'heures travaillées, en fonction du statut d'emploi, si on est permanent ou pas? Quels sont les critères de ce type-là qui vont s'appliquer?
The criteria that was put forth by the federal government was based on the threshold of income for a full-time worker. I think as we look at the 4-month provision, we're looking at people that actually, started during the pandemic, let's say if we go back into the end of March, and for 4 months leading up to that. We know that in some cases, in daycare workers starting up, as we're getting into the economy, it's a little different start date. But the idea is looking at, and that's what their qualifications were, full-time employment that had less than $2,500 a month.
Merci. M. Corriveau, as-tu suivi?
Merci, Bruce. Oui. Sur le même sujet pour M. Higgs toujours, pouvez-vous nous expliquer pourquoi les travailleurs des foyers de soins ne sont pas inclus? Les travailleurs des foyers de soins qui gagnent 18 $ de l'heure et moins, pourquoi ne sont-ils pas inclus par la province qui a décidé 5 catégories d'emploi, mais pas celle-là?
They are included in this program. Anyone that earns less than $18 an hour, and in the healthcare field, particularly in this case, would be included.
Thank you, Premier. Merci, M. Corriveau. Mathieu Bois-Comeau, l'Acadie Nouvelle.
Bonjour, ma question est pour le Premier ministre Higgs. Dans la lettre du ministre Trevor Holder au ministre fédéral Bill Morneau, il est question de 2 phases au programme en lien avec ce dont on vient de parler avec M. Corriveau. 2 phases. Pourquoi 2 phases et qu'est-ce que vous pouvez nous dire sur la 2e phase du programme?
Well, the one we're rolling out right now is in relation to what the federal government have offered in their first phase. And I think the only other aspect of us looking at essential workers would be those that have been on the front lines. And I guess thinking particularly of nursing home workers that fell above the threshold, but were ones that were obviously, worked. We've had more people move into the residence because they moved out of the hospitals. I know our hospital workload was down, and that's great because of the COVID crisis never materialized. So that's really good news. But I know a lot of ALC patients moved into nursing homes, so they had more work in their category. They also had volunteers were not allowed to be there to help them. So I know that their workload picked up. So for us to look at how we manage that, what we can do there is the other aspect of what we will have to look at as a province. But I think it's one that we all recognize. A stellar job's been done. It was in the face of a pandemic that extra work certainly went into it. And I know it, we'll never please everyone, but I think that would be a recognition worth understanding.
Thank you, Premier. Merci, M. Wacomo. M. Wacomo, as-tu un suivi cet après-midi?
Oui, merci Bruce. Toujours pour le Premier ministre Higgs. Dans la même lettre, on parle d'un coût de 36 millions de dollars. J'aimerais savoir si le 36 millions de dollars, c'est pour la première phase, les deux phases ensemble, et aussi 36 millions de dollars, combien d'argent la province va dépenser dans le programme.
The first phase is based on the essential workers that meet the threshold of the provincial requirements. And I think the total package, it could have gone a little bit higher, but that is federal money that's being spent in that case. Anything that goes beyond that, and if we look at it for, as I just mentioned, that will be provincial dollars. It won't be, because it's not covered by the federal package.
Merci, M. le Premier ministre. Merci, M. Wacomo. Derwin Gowan, Quaddy Tides. Derwin Gowan. Julien Lecachat, Radio-Canada, Île de Prince-Édouard.
Oui, bonjour. Question pour le Premier ministre, M. Higgs. Monsieur Higgs, question pour vous. C'est assez compliqué la situation avec les îles de la Madeleine depuis quelques semaines. Ce que je voudrais aujourd'hui, c'est avoir des clarifications avec vous qui, depuis, que ce soit le Québec ou des Madelinos, peut traverser les frontières du Nouveau-Brunswick pour se rendre jusqu'au traversier de Souris à l'île du Prince-Édouard pour prendre le bateau. Et ce que je voudrais savoir aussi, c'est est-ce que les personnes qui ont des résidences secondaires aux îles de la Madeleine peuvent bien traverser les frontières du Nouveau-Brunswick? Et si oui, avec quel papier, quel document venant de quelle juridiction? Merci.
So we've been working through that in relation to myself and Premier King, because it's a situation that really sets up the protocol that we would have for New Brunswick and seasonal residents coming back to New Brunswick or to PEI or Nova Scotia. Now we have a situation where we've allowed traffic coming straight through New Brunswick, but for a number of reasons. You know, if you have a home in Nova Scotia, you've been allowed to come through New Brunswick, and if you're providing essential service and commercial activity and such. So we're just now looking at kind of the next phase of what does this mean for exposure to New Brunswick, and what would be the process and the criteria if indeed this would be the case. So I think the only answer that I could give at this stage is that this question is before public health. We are discussing it as what would the protocol look like? How can we be assured that we, you know, because we won't have any control of who's coming as far as where they're coming from. I think as we've said and said it today, we have great concerns about a province that, you know, is still going through the height of the pandemic and people being allowed to leave. We certainly can understand why they would want to leave and move to Magdalen Islands. But maybe the Magdalen Islands have a different view on this, and I don't know if anyone's asked them about it or not, but they may have. So we need to go through the protocol and understand what works. We'll work with officials in Quebec, work with officials on the island because it involves New Brunswick and PEI, and decide if it's possible, but how we can do it and have the absolute assurance that we're not in a position of transporting the virus back into our province.
Monsieur Lecachat, as-tu un suivi?
Oui, s'il vous plaît. Mon suivi pour vous, toujours, Monsieur Higgs. Est-ce que vous avez déjà entamé des discussions avec les gouvernements du Québec et de l'île du Prince-Édouard concernant le passage des touristes vers les îles de la Madeleine en passant donc par le Nouveau-Brunswick après le 15 juin? Car selon les autorités des îles de la Madeleine, des discussions ont déjà eu lieu et selon le Premier ministre de l'île du Prince-Édouard, Dennis King, ces discussions n'ont jamais eu lieu. Alors, où en est-on, s'il vous plaît?
Yeah, I've been discussing this with Nova Scotia or PEI, with Premier King, and I believe his officials have been talking directly with Premier Legault's office. So it's gone in that point at this stage. Those are discussions that have been, let's say, in consideration, and over the last week, let's say, maybe a week and a half.
Thank you, Premier.
Merci.
Merci, Monsieur le Cachat. Andrew Watt, Telegraph Journal.
Yeah, thanks, Bruce. Questions for the Premier. Premier, you spent a lot of time today, both you and Dr. Russell, talking about the importance of reopening the economy. Have you had any thoughts about rescinding the temporary foreign workers ban? And after all, it doesn't seem like there's been much pickup from New Brunswickers, certainly not the pickup you hoped for to fill those jobs.
So the short answer would be yes. I have had lots of thought about it. And the other part about it is you are correct. I mean, I think at this point about 250 people have stepped up and are currently either employed or are seeking employment at either the processes or the farming systems. I believe we have like 100 being interviewed today. Given the magnitude of unemployment in the province, one would suggest that I would have expected it to be much higher, and yes, frankly, I certainly did. It's battling a bit of a headwind, which I was hoping that would be easier to battle, and that is the chronic situation we have in our province with EI. The funding, the federal funding for $2,000 a month to basically stay home and just wait. I think we have, so there's some wins that we need to face, whether it's now or whether it's in the future. We need to deal with that because it's hurting the economy of our province overall. In this situation, I made it from the very beginning. The decision was made at the height of our COVID crisis and where that was going and minimizing the risk to our province. That has subsided somewhat. So looking at the future, looking at phase 3, looking at what it means to where people are coming from. We have some foreign workers that are coming to move here and live here. That's great. We said we would love to see that. We will never turn down any residents to come and want to start a new life here in New Brunswick. But we also have others that are meeting the needs of whether it be farmers or the processing plants. I said I wouldn't let them go without employees, and I meant that. I won't. And if we don't fill a roster in the next few days of what's needed right now, then there will be decisions made to ensure that we can meet the needs.
Thank you, Premier. Mr. Watt, do you have a follow-up?
I do, thanks. Again to the Premier. Premier, are we moving to the yellow phase on Friday?
That's correct.
Excellent, thank you.
Thank you, Mr. Watt. Thank you, Premier. Silas Brown, Global TV.
Hi there. This one's for Dr. Russell. Both you and the Premier today have kind of hinted a little bit that we may be heading towards phase 3 in the coming days here. But I'm curious. A couple of weeks ago, you mentioned that as we continue to open up, testing is obviously going to remain important to try and identify any pockets that may exist in the province, and you had spoken about, potentially broadening testing requirements and implementing random testing. Is there anything of that nature that public health will be moving forward with as we get into the next phase here to try and identify if there are any pockets in the province that aren't being identified or people who just aren't coming forward with symptoms?
Thank you for the question, Silas. The issue around testing is an ongoing discussion at the national level to make sure that we're testing the right people for the right reason at the right time. And we keep coming back to this discussion at the national level because we keep wanting to make sure that we're using evidence-based information to inform our approaches in each jurisdiction. So in jurisdictions where the numbers of cases are low or non-existent, that means that the probability, the pre-test probability will be low. So we have to be very, very careful who we test. And the ongoing discussions at the national level, the most recent one took place yesterday, and it really hammered home the idea that the best testing approach is to test symptomatic patients. And so we do have quite a long list of symptoms right now that you can call 811 and be tested for. Knowing that we want to keep our numbers above a certain amount so that our data is reliable and we can have confidence in that data. So separate from that, there are some targeted asymptomatic testing that we are doing. So we did start doing some pre-op testing in asymptomatic people. And there's some other areas that we're going to be doing some asymptomatic testing. The other thing that we have to always remember is to maintain capacity with respect to what we're able to do. And now that we are doing surgeries, et cetera, there is a backlog of lab tests that do need to be done. So those are underway right now. And then moving forward, it's also important to, if there is another surge in cases and another wave, then we always need to be ready to augment the testing to meet that capacity as well. So as of right now, we're in a really good place. We're following all the national guidance on what we should be doing in terms of who we're testing, and have expanded slightly with some asymptomatic testing, knowing that the biggest bang for the buck in terms of accuracy and doing the right test at the right time for the right reason is for the symptomatic people.
Thank you, Doctor. Mr. Brown, do you have a follow-up?
I do. This one is also for Dr. Russell. The Premier answered or said earlier on that it's people who have symptoms need to get tested, but is there any worry at this point that the low case numbers that we have here are leading some people to maybe be a little bit more relaxed about having one or two of the symptoms on the list that would make you eligible to call 811, and that there could be people who aren't getting tested that should be getting tested?
Well, the other thing, Silas, about opening up the society and the economy a bit more freely in terms of lifting measures, one of the criteria to continue to move forward, including testing, is to have ongoing public engagement and cooperation with all public health advice. So communications with the public will continue to be very, very important around these important messages. So we'll be relying on the media, we'll be relying on messaging through social media, press conferences, interviews, et cetera, to continue to make sure that the public has up-to-date information as quickly as possible so that they can continue to stay informed, continue to be engaged, and continue to understand what their role is in terms of their behaviors and actions that will continue to ensure our continued success with the lifting of some of the measures in place right now. So I think that is a very key component of what we need to move forward and continue to have success. We really need that public engagement to continue very, very reliably.
Thank you, Doctor. Thank you, Mr. Brown. Adam Harris, Telegraph-Journal.
Thanks, Bruce. A question for the Premier. Premier, on the plan to top up wages for frontline workers, just to clarify, the cost of the plan is $36 million. You're saying that's all federal money? I just thought you had to pay a quarter of it. And I wanted to know if there's a limit to what you were willing to spend on this plan, or if there was a limit on what Ottawa was willing to spend.
I think there's a limit. There's certainly a limit on what Ottawa had put on a cap for the whole program, and then there were qualifications of who could fit and who couldn't fit into it. But it's my understanding that the group that we have put in place that meet the criteria, that would be a full federal payout, and then if we go beyond that criteria, it will be a full provincial payout.
Thank you, Premier. Mr. Harris, do you have a follow-up?
Yes, please. Again, for the Premier, other provinces are providing top-ups to all healthcare workers and a wide variety of other professions. Why are you limiting this to just the 5 professions and then maybe nursing home workers too?
So it's an interesting question in every category in this regard, because I've stated a few times that at the end of the day, I'm hoping that we don't have any tax room in the province. We're going to try to, keep our taxes where they are. We want the economy to start up so we get jobs back in place. We want to recognize certainly any individuals and through this process and the role they played to get us this far, and have a criteria around that. It's not, I know that other provinces will have different categories, and I know that there will be a continual thirst to compare one versus the other. I will continue to do what I believe are in the best interests of New Brunswickers and our future. It's not about today. It's about the next 5, 10, 15, 20 years. It's about a province that not only can survive COVID, but thrive in the next generation. I'm very concerned about next year and our transfer payments, because I don't know what's left in the federal government. Given the projections of where the hole that's being dug federally, it's like, well, we won't worry about that today, we'll worry about that tomorrow or next day, or maybe someone believes that they will never have to worry about it. Well, for me, I'm very worried about and very concerned about the next generation. I'm not concerned about my generation as such or myself, but I am concerned about the next generation of New Brunswickers and our ability to continue to grow and live and work here. That's my goal, and I will put the money of the province in places that are needed the most to have us recover the best.
Thank you, Premier. Thank you, Mr. Harris. Laura Brown, CTV.
Hi, Premier. I'm wondering if you can tell me if there's a COVID committee meeting tonight or this afternoon, and what's on the agenda?
It's actually tomorrow morning, I believe. So we're having one a week, sorry. And so the agenda items will include the phased, getting near the 2-week mark, and so Public Health will talk about the phases where we are going into look at the next phase. Some of the challenges we're facing, in terms of the economic recovery, and I know as I just said, there's a tremendous thirst, and there can be different philosophies about how we recover. So we have actually, asked people, asked companies, what's it need to get back up and running? Not how can we just find a way to send you a check, and so I continue to look for the highest value options to ensure that everybody can survive this. And I say everybody's probably a loose term because it's going to be difficult, and I know some situations are much worse than others, but we have a whole, I guess, a broad spectrum of individuals that need help through this. Those discussions will be there today as tomorrow morning as well. And then, of course, the legislature starts next week. So I'm sure that, you've seen the kind of the cracks in the armor, and I'm sure that next week in the legislature, when the cameras are on, there'll be all kinds of criticism flying that didn't exist last week.
Thank you, Premier. Ms. Brown, do you have a follow-up?
Yes, please. Wondering, I know that you've mentioned it already a little bit, but wondering if you are considering during that meeting or broach the topic of allowing Canadian seasonal residents into New Brunswick like PEI has announced today.
So we'll discuss that. That'll be a discussion, but it'll be a discussion with Public Health in relation to what's being announced today. I would only reemphasize that the issue around border security is a main concern to both myself and Public Health, and as how do we manage that and maintain the current situation we have in relation to the virus. I guess there was another item that will be talked about I didn't mention tomorrow would be related to the economic update. We started 2 years ago to be able to monitor monthly actual versus budget, so we're right on top of the situation that we're in now, and what that'll kind of look like going forward.
Thank you, Premier. Thank you, Ms. Brown. Colin McPhail, CBC.
Hi there. This is a question for the Premier. We're hearing from businesses that set up curbside pickup and takeout over the last few weeks that are now in no hurry to reopen the inside of their premises to shoppers and diners, in part because there just aren't enough customers to support them. So I'm wondering, are we at a point yet where you would encourage people to dine in restaurants or shop inside stores again?
Oh, absolutely. I mean, again, following the public health rules, I mean, now is the time for New Brunswickers to support New Brunswickers. And it's more than talking about it, it's actually in action. And so, yeah, if you've been putting off a purchase and you're able to do that, support your local retailer and let's get the economy moving.
Thank you, Premier. Mr. McPhail, do you have a follow-up?
I do thank you again for the Premier. You mentioned earlier the trouble filling temporary foreign worker vacancies, but what is your sense of how difficult or easy it has been for employers, not just farms and fish plants, to get employees to return to work or to fill job openings in general, and why do you think that is?
Well, I think it's something that's probably phased in over years. It's phased in over multiple years. We talk about food security in our province, and if we're really serious about that, we have to have an industry there that not only has support as far as from the government, but it needs to be supported by the people of the province. It needs to have a pay scale that certainly is reflective. And I don't know what the pay scales are in detail, so I can't. That's not a negative criticism. It has to be one of the factors. It has to be supported in terms of buying local and in not only the farmers market but the local food chains. And we have to think about when we buy something. We have to think about, is that carrot that I'm buying locally, is that 10 cents more, but I'm not going to buy it? Or what have we done over the years? If you think about our economy, we like the pay scale, we like the lifestyle, but then we buy the cheapest commodity we can find rather than maybe support a local entrepreneur. So we have to make a decision here as a society, and it's going to be interesting because we're going to see a lot of people resort, quickly back to their old way of life because, we've always been a society to buy things that are the highest value. We may say the highest value may be only in terms of the dollar price tag, not necessarily in terms of the bigger picture. So I think farming and agriculture, food security has to be a major priority. I know that in discussion with the COVID committee, it has been top of mind. I know that it's certainly something that, I've spoken about. Mr. Kuhn has spoken about it at length. I actually had a great conversation with Kevin Arsenault today. And because he operates a very diverse farm in Kent County. And it was really interesting to have that discussion because he talked about all the variables and how the many crops that he has, and in order one goes down, it doesn't wipe out the whole year because he has a diverse economy in that sense. So where are the thresholds of size? Where are the thresholds of what we can grow here safely and in the quantity that allows two main goals, I would say. One is that it's self-sufficiency and sustainability of the farmer and the family. But then there also is the ability for us to feed more than the one family farm members, but also the general society or maybe even export. But I think it's a strategy that's long overdue. It's one of those things that I say that evolves and revolves and reorganizes or reprioritizes every time there's a new government. My hope on the COVID Cabinet Committee thing was that we would be able to pick 4 or 5 key items. We'd be able to focus on them. Food security can be one. Climate change can be another. Education can be another. Economic development can be another. Healthcare can be another. And we stop inventing it every time there's an election. We actually just get on a roadmap and we follow it until we get results.
Thank you, Premier. Thank you, Mr. McPhail. Alexandre Boudreau, l'Acadie Nouvelle.
Bonjour, merci Bruce. Ma question est pour le Premier ministre Higgs. On sait que la protection contre les expulsions de logements prend fin le 31 mai. Premièrement, savez-vous combien de personnes pourraient être expulsées de leur logement? Puis, deuxièmement, pourquoi mettre fin à cette protection-là maintenant alors que l'état d'urgence est toujours en place puis que l'économie n'est toujours pas de retour à la normale?
Do you want me to get him to repeat it?
Yeah, the eviction? People being evicted?
Do you want me to get him to repeat it?
Yes.
Monsieur Boudreau, peux-tu répéter ta question, s'il vous plaît?
Oui, désolé. Donc, comme je disais, c'est pour le Premier ministre Higgs. On sait que la protection contre les expulsions de logements prend fin le 31 mai. Est-ce que vous savez combien de personnes pourraient être expulsées de leur logement à cette date-là? Et deuxièmement, pourquoi mettre fin à cette protection-là maintenant, alors que l'état d'urgence est toujours en place et que l'économie est toujours pas de retour à la normale?
So I understood what you had said before, but I didn't quite understand the question. So we're saying the emergency order is still in place, and we're saying evictions. We're meaning people that are moved out of the province, people that aren't allowed to stay here in the province or turned back? So that continues. It doesn't end. The emergency order's in place. I mean, I'm not familiar that it ends May 31st. So that's news to me.
Donc, pas certain de comprendre, pardon, la protection contre les expulsions de logement
Oh, sorry, okay. My apologies. Yes, I thought you were talking, but yes. Fair enough. So the apartment evictions, yeah, that does end. Now, we are in touch with landlords. We are keeping track of that. I mean, it's one of those things that has to end at some point, and the idea was to get through the crisis, not be in a position here that we had trouble, in the middle of a pandemic and people with no place to go. But at some point, you have to get back to some degree of normality. But we will continue to work with landlords and tenants to understand the situation at that particular time, and see that our protections are being followed, that any tenant situation that arises, that we have a place for people to go. We have an extensive social safety net here in our province, and we're blessed to have that. So, but at some point you get back to a normality here of the timeline. So we'll look at that. I don't think there's a reason to extend it beyond May 31st. I'm not aware of discussions to do so, but I'm sure it'll likely come up in the next few days. My apologies. I was thinking more of turning people back at the border.
Merci, M. le Premier ministre. M. Boudreau, as-tu un suivi cet après-midi?
Je voudrais aussi savoir, toujours pour le Premier ministre, j'ai parlé au ministre Bruce Fitch plus tôt aujourd'hui. Il a parlé de la possibilité de réouvrir les frontières du Québec cet été pour le tourisme, mais il dit que la décision devra venir de vous. J'aimerais savoir quels sont les facteurs à prendre en compte avant d'ouvrir les frontières avec le Québec. J'aimerais savoir quand est-ce que vous pensez que ça sera possible.
I think Dr. Russell's been clear on that as well as I have. I don't see that happening this summer, certainly in the coming months and weeks. Dr. Russell, if you'd like to talk about that.
La question a été posée en français, oui.
Merci.
Oui. Alors, les discussions au niveau national avec l'Agence de santé publique du Canada, avec nos collègues qui sont des médecins hygiénistes en chef tout autour du pays, on a discuté quelles sortes de critères qu'on voulait regarder pour voir si on pourrait ouvrir les frontières, quelle sorte de décision on voulait prendre, puis c'est vraiment va être basé sur les nombres de cas, la sorte de transmission qu'on voit et le facteur de R qu'on communique avec les épidémiologues. Oh my goodness, épidémiologues. Alors, ça, c'est des conversations qu'on va continuer à avoir, puis on va continuer à avoir les nombres de cas dans toutes les provinces tout alentour de nous pour faire des décisions comme ça. Et au fur et à mesure que la situation améliore, on peut continuer à avoir des discussions sur ça. Mais la limitation, c'est que un des critères pour ouvrir les choses à l'intérieur du Nouveau-Brunswick, pour l'économie, pour la société, c'est vraiment dépendant sur la protection des frontières et éviter d'avoir des cas liés au voyage en hors du province ou que les cas soient importés en dedans de la province.
Merci, Docteur. Merci, M. Boudreau. Tom Fenario, APTN.
Hi, I have a question for the Premier. You've already mentioned that there'll be no exception over border restrictions, but considering that Liskebush First Nation, just across the river in Quebec, has requested additional exceptions to be made, will there be any consideration to letting more of their members go to Campbellton, seeing as how it's part of their ancestral territory?
Well, I've been extremely impressed with First Nations communities and their diligence in protecting not only their communities, but certainly protecting the communities that they live in from any spread of the virus. And they've been very, very successful to date. So I guess I would say I don't believe that they would be entertaining anything here that would actually jeopardize that. Equally, I think they would completely understand the rationale between our border security issues and the need for that. So there may be discussions going on with public safety in relation to what they're actually asking for, but to have a wholesale movement back and forth, I think would be risky for us and risky for them as well at this stage. And maybe they've offered some details. I've heard something about a particular identification pass, and that may be something that in line with new rules that we have and families getting together and that sort of thing. But right today, I haven't seen any formal proposal. I don't know if Public Health have or not. but I would be interested to know what they're actually asking for, and is there a different definition to some of the essential services they're looking for, and we'll go from there. But a wholesale opening of the border just between communities on either side, we'd have to look long and hard at how that would work effectively in light of all the other restrictions we have.
Thank you, Premier. Mr. Fenario, do you have a follow-up this afternoon?
Yes, I do. Chief Darcy Gray of Listigosh First Nation sent you a letter on Friday. Have you, Friday the 17th, that is, have you responded to him, or has anyone from Aboriginal Affairs responded to his?
Not that I'm aware of. I have not read the letter yet. I haven't seen it. I likely will. If it was addressed directly to me, then I will see it. But I haven't yet, so I can't respond to it.
Thank you, Premier. Thank you, Mr. Fenario. Derwin Gowan, Quaddy Times.